Hi, my name is Jennifer Diamond Hardesty and I'm a physical therapist with TennisElbow.com. In this video we're going to talk about the use of heat, specifically moist heat, as a treatment modality for tennis elbow or golfer's elbow. Moist heat is different from dry heat. It is able to penetrate tissues deeper than dry heat. Dry heat is, think of just a basic hot pack, like one of those rice bags or something that you just heat up in the microwave. That would be dry heat. Moist heat is, in physical therapy clinics, they use clay hot packs in a hydrocollator, which is basically a big vat of hot water. Or at home, if you're using heat for self-treatment, you could use moist heat in the form of taking a shower and making sure that the hot water really gets on your elbow, taking a bath with your elbows submerged, hot tub, that kind of thing. So moist heat. Oh, you could also take a regular hot pack and wrap a moist, warm towel around it, and that also accomplishes moist heat. So in Chinese medicine, heat is thought to really speed healing. They even put it on, really acute injuries. So if you just sprained your ankle, it wouldn't be unlike a Chinese medicine practitioner to put a hot pack directly on it. In Western medicine, often heat is, they consider it being pro-inflammatory, and so not something that you would use on an acute injury. Generally, if something, for my personal practice, if somebody just injured themselves a week or so ago, less than a week ago, especially if there's active swelling, an active hematoma, if they are noticing that the heat increases their pain, then I don't use heat. I usually use it if it's been a week to 2 weeks, after the injury and the swelling has gone down, that kind of thing, then at that point I'll start using heat. And you can use heat in a variety of different ways. You can use it as a standalone treatment, just putting the hot pack on 15 to 20 minutes, or taking a long shower, making sure that that warm water really gets to that elbow. You could, make sure that you are paying attention to the skin as well. Like, you don't want to just leave a hot pack on and then fall asleep. You don't want to do that with ice either. So just checking the skin, making sure, it's going to get pink. It might get a little pink and blotchy, same with use of ice. That's just because of blood flow changes. So speaking of blood flow, when you use heat, the blood vessels themselves actually dilate. And when you use ice, the blood vessels constrict. And sometimes people will alternate the use of heat and ice. So the blood vessels will dilate, constrict, and that's kind of a pumping mechanism that helps improve blood flow. So sometimes people will alternate heat for 15 minutes and then ice for 15 minutes, heat, and then ice, heat, and ice. And that can be a really effective treatment modality for pain relief. I personally like to use heat prior to self-massage, and so we'll have a separate video about self-massage techniques, so keep an eye out. But using heat prior to self-massage can help because it makes the tissue more pliable, and it softens it. So if you have any muscle guarding going on, that can be a really soothing use of heat to try to kind of calm the muscles down, calm the nervous system down before you apply touch or pressure, which could potentially be irritating if you don't take some steps beforehand to calm everything down. But that's the use of heat. I love it. I'm a big fan of moist heat in particular. So, if you're feeling like your elbow is particularly achy or whatever, jump in the shower and make sure that you get that elbow really nice and warm. All right, keep an eye out for the self-massage video. Thank you.